Good morning. I am Dr. Sam Abraham, Director of Abraham Fertility and Gynec Center of Changanasheri. See, there is a cancer of the uterus, that is the mouth part of the uterus, is called cervix. So, cancer can occur in the cervix. The biggest thing we have to know is that this cancer is something which we can detect very early, and once you detect it very early, it is 100% curable. It takes years for this cancer to develop. So what the woman has to do, any lady who is sexually active from 21 to 65 has to do this PAPSMEAR test once in 3 years. That means we are taking cells from there and we are looking for abnormal cells. And then what will happen is that if you detect these cells early, you will be able to diagnose this condition early and treat it. You can do it with your naked eye, or we can do it with colposcopy. Colposcopy is available in our center, where we do stain that area, take the abnormal cells and send it for study. And then we have to understand that human papillomavirus infection is there. It is an infection which can lead to cancer. So any sexually active woman can contract it. It is spread by body to body contact. It is spread by oral, vaginal, anal contact. So any lady who is having multiple partners, or her husband has multiple partners, may contract this disease. The thing is that if this is not detected early, it can lead to cancer. So in the PAPSMEAR test, you can study DNA of the human papillomavirus, which will help to identify the disease early. Now the problem with human papillomavirus is that it may not cause any symptoms in the early stage. Sometimes you may see some warts, some fleshy projections there in that area, which you may miss it. So what you have to do is, every lady who is sexually active does this test once in 3 years for PAPSMEAR, or they can combine PAPSMEAR and DNA test for papillomavirus. If they combine that test, they need to do it only once in 5 years. So I strongly recommend that every lady between 21 to 65 years, they have to do the test once in 5 years. You see, do a test once in 5 years, then you are protected from this disease. It's not a simple thing. So we have to be aware of these things. So it's a very simple test you can do in your OPD. It takes only a few minutes for this test to be done. Now we have to be very clearly understand the fact that ladies need screening. Cervix is a cancer which is, if detected early, which is preventable. And there is no treatment for human papillomavirus. You can take vaccine for girls between the age of 11 to 13, which will give them protection against this type of cancer. So I strongly recommend that every lady should not wait for symptoms to appear, but they should have a screening for PAPSMEAR once in 3 years. If they are combining papillomavirus and papillomavirus stain test plus cervical PAPSMEAR test, they can do once in 5 years.